A highlight of the ASH annual meeting is always the plenary session, featuring the best abstracts submitted. Dr. Dunbar, ASH Secretary, gave us an overview of this year's plenary abstract presentations.
Almost 8,000 abstracts submitted to the annual meeting this year. We had a lot of great work to choose from. For the plenary session, we strive to feature abstracts that are practice-changing or paradigm-shifting, and that can be made accessible to a general audience of clinicians, scientists, specialists, and students. I think we fulfilled that goal this year. As a physician scientist myself, focused on hematopoiesis in my own lab, there was a lot to get excited about this year. In Abstract 5, we heard about deficiencies of a critical nutrient during pregnancy, specifically folate, and how it might impact on the lifelong function and health of marrow stem cells following delivery. So folate deficiency has got a lot of interest in terms of its impact on neural tube defects and other birth defects, but it hasn't been studied previously in terms of its impact on hematopoietic stem cells. Really profound changes can occur in hematopoietic stem cells that are folate deficient during pregnancy, affecting a premature aging phenotype in offspring, with potential impact on ability to tolerate chemotherapy, transplant, etc. Obviously, this needs to be confirmed in human epidemiologic studies, but I think most of us left the room thinking that, wow, better take those prenatal vitamins. There were several abstracts with great relevance to the treatment of sickle cell disease, spanning the globe, focusing on 2 oral therapies, one available for over 30 years, namely hydroxyurea, and another looking at potential promising new oral drug treatments. So US, Canadian, and African investigators provided a critical long-term update on results from the REACH trial, a prospective look at early treatment interventions with hydroxyurea in children with sickle cell disease in sub-Saharan Africa. Intensive monitoring was not required for safety, as we heard, and with up to 8 years of follow-up on hydroxyurea, they observed a remarkable decrease in vaso-occlusive crises, stroke, and other serious organ toxicity, as well as a more than 3-fold decrease in mortality. So this really brings out the point that effective therapy can and must be delivered to patients in low-resource countries. But hydroxyurea doesn't normalize life or prevent complications for all sickle cell disease patients. So it was incredibly exciting to hear preclinical data from scientists at Novartis in abstract number 2. They took a novel approach to identifying drugs that could turn on fetal hemoglobin via interaction with transcription factors. And they found a molecular glue, small molecule degrader, that interfered with a new transcription factor called WIZ that was able to turn on fetal hemoglobin in human erythroid cells from patients with sickle cell disease, as well as turn on hemoglobin F in a very potent way in a monkey model. So the movement of this oral WIZ degrader to the clinic will be eagerly awaited. And in terms of transplantation, there was a really interesting abstract about a new treatment for graft versus host disease. When I first considered going into hematology as a career, I wanted to do transplantation, but taking care of patients with severe chronic graft versus host disease that had very few options for improving their life was really intimidating to me. So I went into the laboratory and studied some other disorders. But this year there was real progress reported in the plenary session for treatment of severe transplant complications with graft versus host disease. Specifically in the AGAVE trial, using axatizumab, an antibody that blocks the CSF1 receptor on macrophages. It's been shown that in chronic graft versus host disease, the interaction of CSF1 with its receptor is a driver in many of the complications that occur in terms of fibrosis and damage to tissues and organs. So the overall response rate was 74% in the optimized dose cohort, with durable responses in a majority. So this is really exciting news for patients undergoing transplant, especially as we begin to use more alternative donors. There were also a number of abstracts looking at new approaches to treatment in patients with blood cancers. The results of the Phase 3 ISCIA multiple myeloma trial were reported out by a European consortium. They compared the addition of a directly cytotoxic anti-CD38 monoclonal antibody called isatuximab to standard triple induction and consolidation with carfilzomib, lenalidomide, and dexamethasone. They used the increasingly common primary endpoint of molecular minimal residual disease for their readout. There was a significant increase in MRD negativity seen in the patients that got the isatuximab. These results held up even in very high-risk myeloma patients. Finally, there was a very exciting translational abstract on the development of a strategy to treat malignancies with splicing factor mutations, namely myelodysplasia and chronic lymphocytic leukemia. Patients from Memorial Sloan Kettering Cancer Center used a highly novel approach to studying mutations in SF3B1, the most common mutation in splicing factors in myelodysplastic syndromes. And they identified a critical protein in the splicing machinery called GPatch8 that was required for the splicing abnormalities occurring in patients with these SF3B1 mutations. They found that decreasing production of this protein via RNA inhibition could correct the defects in MDS cells, and we look forward to moving this forward to a specific therapy for these difficult to treat patients. I hope that many of you were there in person to hear these abstracts presented, but if you weren't, hopefully this summer will make you go read the abstracts and look forward to the exciting papers that are certain to come out of these in the near future.